We care about defending dignity and fighting poverty. And we care about people who work from sunup to sundown to secure the basics of a healthy life, about the repercussions of a global economic system that traps more than 1 billion people in poverty, most of them women and children. I wish it were so self-evident that all we had to do is to say to one another, well, we care about this, and action would somehow burst forth. But we need to be the actors. We need to channel our care into concrete actions. Like care, we believe that by creating the conditions in which families and communities thrive, we can promote stability, opportunity, and progress far beyond any one community and even one country. As governments and organizations search for strategic interventions in the fight against poverty, places where our money and our effort can make the biggest and most lasting differences, nutrition represents a ripe opportunity. Now, whether the primary focus of these programs is agriculture, health, or education, nutrition is the common thread because it's an issue that cuts across every sector. It's an economic issue. Undernutrition costs individuals more than 10% of their lifetime earnings. It's an education issue. Undernourished children struggle to learn and to stay in school. And it is, of course, a health issue. 1 in 3 children worldwide suffers from undernutrition. In some countries, half of all children are stunted. More than 3 million children and 100,000 mothers die every year from causes related to undernutrition, which weakens immune systems, makes people susceptible to other health problems, such as anemia, which is a leading contributor of maternal mortality. So nutrition is a universal need, and people of all ages and circumstances deserve access to nutritious foods. But the 2 groups that have the most acute need for improved nutrition are pregnant women and children, particularly babies. But it also reflects the particular health needs of women, especially mothers, and especially young children. Nutrition plays the most critical role in a person's life during a narrow window of time, the 1,000 days that begin at the start of a pregnancy and continue through the 2nd year of life. The quality of nutrition during those 1,000 days can help determine whether a mother and child survive pregnancy and whether a child will contract a common childhood disease, experience enough brain development to go to school and hold a job as an adult. The science of nutrition points to a strategy. If we target that brief, critical period during which nutrition has the biggest impact and focus on improving nutrition for expectant mothers, new mothers, and young children, we can accomplish several things at once. We can save lives, we can help children start life on a better path, and we can bolster economic development and learning down the road. So that's the thinking behind the Obama administration's new approach to nutrition. For the first time, the United States is focusing our investments on that 1,000-day window. We're identifying millions of young children who need nutritional support, and we're sticking with them for a 3-year period to give them a foundation to lead healthy lives. We're also significantly scaling up our investments in research and development to discover what we hope will be path-breaking tools and technologies, ranging from new techniques for measuring undernutrition to new supplements to new biofortified crops. Through the Feed the Future initiative, we're helping to strengthen agricultural systems to accomplish 3 things: increase the amount and diversity of food grown, improve markets so people have access to that food, and increase people's income so they can afford to buy more and better quality food and put more of their daughters and sons in school. All 3 outcomes, we believe, will help reduce undernutrition, particularly if we ensure that the benefits reach women, who are more likely to pass them on to their children. That's a lesson we've learned in microfinance and in most programs Focus on women if you want lasting, measurable results. And we will continue to work with groups like CARE. CARE has spent decades promoting effective, innovative strategies for nutrition, women's health, children's health, agricultural development, and other related issues. Many of the best ideas for how to solve this problem have been conceived by or refined through the work of CARE and its partners. And we're building on that foundation because we think it will serve us well in the future. I'm inspired by the example of so many people around the world every single day. The women and men whom I've met who, against the most daunting odds, have made a difference for their families and their communities and just didn't know the meaning of the word impossible. Well, CARE has been on the front lines of that struggle for such a long time. And I so admire the work of this organization, its global mission, its can-do spirit, its fearlessness in the face of insurmountable odds. But now we know more, we understand what works, and so we have no excuses left. Whether it's a government or an NGO or an individual or a private business or anyone who cares, there's a role for us to play. And I thank each and every one of you for what you are doing on behalf of that mission.